Hi, my name is Macy Goodman. Have you realized that there's been an increasing number of suicides in the Mahoning, Shenango, and Trumbull County areas? Well, my group and I are going to explain what should be done about this. First, we are going to begin by looking at the background of suicide. Then we will move on to what can be done within the community to help, as well as explaining why this is important. Finally, we're going to include stories and statistics in order to prove that this is a problem. So the first thing to discuss is history. Why do people decide this terrible outcome for themselves? The main reason is because of mental illness. Over 90% of people who commit suicide have a mental illness, and of those, depression is the most common. People can become depressed for multiple reasons, including abuse, feelings of hopelessness, experiencing major loss, the use of drugs or alcohol. So there's also been shown to have a genetic factor in suicide. And those who commit suicide are shown to have a family history of it. The genetic link has to do with the serotonin receptors in your brain. And serotonin is a chemical that controls your moods and can make you happy. Well, when this mutation occurs, it affects the uptake of serotonin and can cause depression. People who have this gene are twice as likely to become depressed and commit suicide than those who are only depressed. Thank you.
Hi, I'm Gina, and I will be doing the background and history on my group's project, which is suicide in Trumbull-Mahoning areas. So suicide occurs almost twice as often as murder, and each year around 36,000 people take their lives. Suicide is the 10th leading cause of death, and the most common method of suicide is by using a gun. People who most likely consider this usually have a personal or family history of suicide attempts or completed suicide in their families. And that's also along with history of severe anxiety, depression, or other mental illnesses, like bipolar disorder, which is a manic depressive illness, or schizophrenia. And they also could suffer from a drug or alcohol problem. Bipolar disorder causes major changes in moods, energy, the way you think and behavior, from the highs of mania to the extreme lows of depression. And that is according to the helpguide.org. Individuals tend to make impulse decisions when having an episode, which could cause them to take their own lives too during having bipolar disorder. Schizophrenia, on the other hand, that interferes with a person's ability to think clearly, manage their emotions, make decisions, and relate to others. And people often hallucinate when they have schizophrenia, and that can cause people to hear voices, see things that aren't there, smell things they can't perceive, and when thinking false thoughts and beliefs, that could also cause someone to take their lives, and that could be on accident as well. So according to Ohio's pf.org, Mahoning County has a suicide rate of 11 per every 100,000 people. 84% are male, and the age group that has the highest suicide rate in Mahoning is 45 to age 54.
Suicide is the third leading cause of death among young people, resulting in about 4,400 deaths per year. Over 14% of high school students have considered suicide, and almost 7% have attempted it. If there are assemblies and classes implemented in the school system more often, suicide can be prevented. For example, a suicide prevention program is a good way to get awareness, and also making sure that the Suicide hotline number is posted in the community as another way to get awareness. Signs of suicide include trouble sleeping, making preparations, if a person writes a note and has a plan of how that they're going to kill themselves, sense of personalized hopelessness, if they feel that they're constantly hopeless and there's no hope for them in life, talking about suicide, if they Google ways to die in quick and easy and painless ways, isolating themselves, if they pull back from family and friends and don't really want to be involved in social interactions, feeling that they are a burden is also a sign of suicide. If they feel that they're constantly in the way of people and people would be better off without them. Also, bullying is one of the number one reasons contributing to suicide. Kids that are bullied in school often feel like they have no other choice and that they're hurt and they feel that they need to commit suicide. So implementing these classes and assemblies in the suicide prevention program will get the awareness out for these kids and will encourage them to speak up and get help.
Suicide. The elephant in the room that no one wants to talk about until it's too late. That's why we chose it as our topic. In Mahoning County, where 84.9% suicides are male. Nobody wants to address it though. There's a stigma that's attached to it, especially for the victims who commit the ultimate act of suicide. Usually they're suffering from depression, drug addiction, loss of a family member, something that's preventable if the proper tools are available to that person. Our video, hopefully, will be used as a preventative tool to help individuals who are dealing with it and feel like there's no one to talk to or no one to reach out to. Being a student of YSU and understanding the importance of this issue, I hope our video opens up debate, dialogue at the campus and in the community as well to bring about maybe a coalition or a foundation or something for individuals who feel like there's no place left to turn. Thank you.
Hello, my name is Paloma Matthews, and I want to give you some stories from loved ones and news stations that have happened about suicide. Well, the news stations actually around here have done a few stories on some suicide occurrences, and they're actually quite sad and just depressing. And one of them was about a murder slash suicide in Girard, Ohio. And it was about a 76-year-old named Alice and her daughter, 46-year-old Mary. And they were found in their home, both shot and with suicide notes. And they said that the family reported that they have been acting suspiciously for a couple of years, but it's just sad to hear that a mother and daughter together would do that. Now that happened around here, so I wanted to find something that was a little more uplifting, more like meaningful and not just like tragic like that. So I went to a different source, and they have a lot of stories on there. It's from save.org, and they are a lot more meaningful, obviously. They're from friends of people who have passed away, and I'm not going to read their whole story, I'm just going to sum it up. But in one of their stories, the friends and family, they gather around every year on his birthday, and they still like remember him and go over like their past times with him, and they like just say all the things that they miss. And they posted it saying, I don't know if this is healthy or okay to do, but the website actually responded to them and said, like, whatever way helps you get through it, like, this is a totally fine, normal way. So there's ways to get through it like that, like, you don't want to forget the person. And then also another story was told by someone who was a friend of a boy who committed suicide.
and he said that he just never expected it from the person. Sometimes it's the person you never knew that commits suicide, and it really devastated that person when this happened to his friend. So he goes on to say something really powerful in the end, that I don't want anyone to forget that you're never alone, and there's always like help for you. There's always someone who cares about you, and that's really important to remember. So thank you for listening to our presentation, and I hope this opened your mind to the happenings around here, and this is a real thing, and just maybe you'll help someone or this helped you. Thank you.